warm in here?
No,
Fine, good.
it's perfect.
It's fine.
Alright,
You just start bringing you a sweater.
I'll sweat.
We're gonna need them.
Alright, so lab session for removables. Okay, so an overview of the appointments for a complete denture. Again, initial exam, treatment plan, okay, first appointment. Make sure the patient, you talk to them and again start to get them mentally prepared if they want a denture. Start telling them, you know, especially if they're going from teeth to no teeth, it's not going to be, you know, peachy. You're not going to have to get used to it and you have to start
What
claiming
lecture
it.
is this?
This is in the lab.
Oh,
Yeah, this is the lab for the removal.
Yeah, no, we were like that too. We were like, wait a second. Threw everyone off. We all thought we were doing
See if you guys are awake. Let me go see if that printed over here.
Are we doing 14 after this or no?
Huh?
Are we doing lecture 14 after this? Oh, okay.
Or fixed. Yeah, we're doing
Okay.
fixed partial dentures.
We were just curious because it says it in our schedule.
So a complete exam including treatment plan, x-rays, and study models are completed. At this appointment, the treatment plan is presented to the patient, including the treatment and sequential steps involved in fabricating. And usually it takes anywhere, depending on your technique, from 4 to 6 visits to fabricate these. So patients think that, you know, they're coming in for a denture and you're just going to pull out of a drawer and you're going to hand it to them. It's going to take a month and a half, you know, to make. And if they've got oral surgery, it may take longer if we've got to get teeth out, if we're going to allow them to heal. So patients need to understand that. Okay, you do the oral surgery. After you take your preliminary impression, send it off to the lab. The lab's going to chop off those teeth off the model, the stone model. They're going to make your custom tray. At that time, you send them to the oral surgeon, or if you do the surgery yourself, and you extract all the teeth. Okay, so then they heal for 4 weeks or so. Okay, and then the patient comes back. Unless you're doing an immediate denture, then you're going to leave the front ones. But if they don't mind going without teeth, like this patient yesterday, I did the relay. I said, today's Thursday, we're closed Friday. You're not going to get your denture back till Monday. I said, oh, that's okay. Can't wear it anyway right now. Okay, a lot of soup, and
Ice cream.
ice cream, yeah.
Mashed potatoes.
Mashed potatoes. So again, you get the surgery done and allow them to heal. Then the patient comes back, you've got your custom tray, you take your final impression again to get the definition and to get the detail. You get your wax rim. You're going to set your jaw relationships or your bite registration. Get your midline, get your lip line, everything. Teeth come back with wax. Okay, so now you do your wax try-in, make sure everything fits good. Patient likes the size, shape, and color of the teeth. And they sign off and say that looks good, and you get the husband or the daughter or somebody to say it's good. You deliver it, and then you make any adjustments at the end. Okay, so again, that's 6, 7 appointments. Okay, so appointment number 2, I guess, or number 1. Preliminary impressions. Again, you just take an alginate impression. Okay, what are you going to write on your lab slip? You know that, right? Please fabricate custom tray. Okay, out of the preliminary impression, please fabricate custom tray. Okay.
So I need to go over this.
Yeah, and you'll be able to take pictures, and this, I think we've got these on a little ring binder here, you won't have to memorize these. You'll have to know the order, more or less, and if you're not sure, make sure you ask the doctor, you know, what do you want me to write on the last step? But I think we've got them here on a little ring binder, and the girls just look at what they're gonna write. Or they'll say, what do you want me to write? If there's any changes, if you're changing a step, then the doctor will tell you, add this or add that, especially if it's a partial. But usually these are pretty generic, okay? Except for the shade of the tooth. You know, you've got to make sure you've got the right shade wherever, not on this one, but when you select your tooth. This is what you're going to get back. We just saw that. You take your final impression to get the detail. Again, what you need out there, and you'll look at the setups. Okay, you need your basic setup, mouth mirror, explorer, your air water syringe, all the usuals. Your custom tray that just came in. This wax, some doctors use it, some don't. Okay, and I'll show you what it is. It's a green wax that you soften, and we call it border molding. So you get your custom tray, and you border mold the edge of that custom tray to even make it more form-fitting to the patient. You warm it up, put it in, and you tug on the lip to really get that roll of that vestibule, so that when you put your impression material, it's just got to, you know, basically it just outlines that border molding and fills in any voids. So this is, I think, I don't know if you've got this in your, or where I got this, but this is kind of what it looks like. You've got your trays, the border molding material, you've got your bowl, usually for hot water. This is your Bunsen burner, or this is a hand-out torch. It's just a light fire. You can alcohol torch. You light it up and warm up the material. You've got your wax spatulas or knives. You've got Vaseline for the patient's lips. You've got a mixing pad and your impression material over here. This is kind of what we set up, and I think Dr. Cervantes will set up in the rooms for your impression, for your final impression. Here's a tray, and this is adhesive for the tray, just to make sure that the material sticks. We'll use the impression material just like we do for crown and bridges for detail, and your mixing pad. Not a lot of setup, and that's mostly what on these. Mostly what you guys do is set up all the materials that are needed. There's not a lot. Usually these appointments are pretty short, 15 minutes, except for the bite registration. It may take half an hour, but usually it's a quick appointment. Patient comes in, you try it in, and then they're out. So your final impression, the custom tray comes in. Here, this is the border molding, where you heat the compound with the Bunsen burner or the alcohol torch, and you go all the way around the edge to border mold that. Okay, so here you see it's a green compound. You saw when you heat it up, it's kind of runny, and you got to be careful because it's like hot wax. You drop it on you and it hurts. And so you want to be away from the patient when you're doing it. And so you get it hot and soft, and then you temper it. You put it into a warm water bath just so that it's hot and moldable, but not scalding, so that when you put it into the patient's mouth, it doesn't hurt. And you're not doing this, the doctor's doing this, okay? So, but then this is what border molding is. Okay, again, you're just making that custom tray more custom for the patient. And this is kind of what it would end up looking like. Okay, so it's a border molded custom tray. Then you put the adhesive on this, and the doctor will take the final impression. Again, the impression, you take the upper or the lower, depending on what material you're using. Wait for it to set, and this is, again, we saw this really detailed. And you repeat that procedure for the opposing arch. Once both are taken, you package them and you send them to the lab with the prescription form. You dismiss the patient. then you set up for the bite registration. So please fabricate base plate and wax rims on the master cast. So you're going to get this back from the lab. Okay, you've got your base plate, which is the acrylic that's just over the custom cast, and then you've got your base plate to register your bite. Okay, so jaw relationship, bite registration is synonymous. Okay, so it's the same thing. So your jaw relation, you're kind of registering the jaw, how they relate to each other, or the bite registration is the same thing. The procedures performed by the dentist. During this appointment, the relationship between the maxillary and mandibular arches are established. In addition, the patient's preferences are discussed at this appointment and the prosthetic tooth shade is selected. So what you need, again, basic stuff. A hand mirror is the patient mirror that the patient can see. Okay, so they can look at the shade. A lab knife, wax spatula. Again, there's different types of wax spatulas. You need to know what wax spatulas you're giving, either not the small one or the big, whatever the doctor needs. The wax spatula to shape the wax, not to move the teeth. I'll show you some of those. The Bunsen burner or the alcohol lamp. Some offices will have gas lines coming out of the wall. So you'll need the Bunsen burner that you plug into the wall and you turn on the gas. So it just depends. We don't have that. We have alcohol, little alcohol lamps. A shade guide, a denture shade guide. There's a difference between the crown and bridge porcelain and denture teeth, and we'll show you what those are. A Boley gauge is a measuring device to measure the distance from the nose to the chin when we're measuring how to set their bite, how open to make them. Anyway, here's a lab knife and here's a wax spatula. Okay. Here's a Bunsen burner. Again, this is a gas one. You can see the hose going up to the wall. This is what we have. This is a hand-out torch. It's filled with not rubbing alcohol. It's got to be denatured alcohol. Okay, so when they tell you please put alcohol in this, it has to be denatured, not because you'll find rubbing alcohol that we used, in the operatories. But what you put in here, you put denatured so that it'll light and not blow up. Okay, so be aware that there's a difference. Don't just add alcohol because we'll be calling 911. And this is another alcohol lamp, also same with denatured alcohol. This is the denture tooth shade guide. Okay, you'll have more shades than what we have for porcelain. Porcelain, you're probably stopping right here. You probably have 8 shades. With denture teeth, you've got 20 some shades. This is the Boley gauge. Okay, it's just in millimeters. It's just a little ruler. You put when we use it, we put a dot on the patient's tip of the nose and a dot on the patient's chin. We have them open and close multiple times, and then relax, and we find the measurement. We call it the vertical dimension, where they're comfortable. Okay, and we do that multiple times and get a reading. And then once we get like the average, then that's where we're going to set the wax bite. Okay, that's where we're going to register the wax, or have them close into that wax so that we can make the denture at that opening. Again, this is just playing around with the wax to get the desired height and measurement. Once we get that height and shape the wax, then we're going to dismiss the patient and we're going to write the prescription. Here's basically the wax bite, and you can see we marked the midline. I normally will have them smile, and I'll mark their smile line way up here wherever they smile, so that the lab knows sometimes how big a tooth to put. So please fabricate wax trine with teeth shape A3. And you can see here A3, A3. Please mount on articulator with opposing cast. So they'll put it on a little hinge articulator to set the teeth. It'll come back with the teeth in the wax, and this is where we try them in. Try an appointment. Let's see. When when they come from the lab, usually they'll be disinfected, but you can disinfect them, squirt them with the spray, and rinse them out. Seek the patient, have them try them in, give them a mirror, get feedback from the patient. Once the patient is satisfied with what they see, then you have them sign and say, okay, you go okay to process, you show it to the husband, and this is what we're gonna see from the lab. Again, they're set into wax. At this point, if the patient says, oh, this tooth is too long, we push it up. If it's too short, we pull it down. Again, depending on what the bite allows us to do. And we make any adjustments. Once they say okay, then you write process. Okay, so this is, you have the patient look at it in wax there to make sure they like what they see. And then once you put process, make sure the patient understands that any changes after that,
In my pocket.
yeah, that aren't anything that we did. If the bite is way off or anything like that, then that's not their problem. But if it's an aesthetic that they don't like the color or the size of the teeth, or then that you're okay to they're going to charge me another $60 to reset them or whatever is coming out of your pocket. And then you deliver the appointment. You give the patient a little container that they can hold them in. This is for the delivery appointment. You've got, again, a hand mirror, the dentures from the lab, articulating paper to check the bite. You're going to have the slow speed handpiece with a nose cone with acrylic burrs to adjust the bite. You try them in, check the bite, and you that's kind of what they look like. Okay, so you can go from something like that to something like that. Like with immediate dentures, again, we've got anterior teeth. Here it looks like they've got a molar here or a premolar. But
Teeth
usually
make such a big difference.
oh yeah. I mean, some patients, they've kind of held out and they just haven't done anything. And sometimes it is, they go, you'll see patients cry, when you put them in. They can't eat with them yet, but they look good. And some patients just want it for aesthetics, they'll gum food, they'll take them out, but they just put them in and they look good. And some patients just don't get used to them. Okay, partial dentures, it's kind of the same thing. Initial exam, final impression, try-in and adjustment, wax try-in, delivery adjustment. Okay, so for your partial denture, let's see, what is this? The assistant is responsible for setting up the operatory, making and mixing, transferring impression to make your custom tray. Fit in the custom tray, the impression material is prepared, so either you'll mix it or the dentist will mix it. Put the impression in the tray. Okay, so please fabricate cast framework for the RPD and attach base plates. You'll see this in the room right now. So again, that first appointment is basically just getting your impressions. This is what we're going to get from the lab. We just saw that try-in appointment. I'm trying to see if there's anything on the test. I'm trying to see what. Try the framework in, make sure it fits passively. You don't want to force it down in there. It should just snap on and not put any pressure on the teeth. So register the bite. Saw these, take a shade. Okay, again, if it's a long span bridge, we're going to use a wax rim. So this would be, anytime you have teeth in the back, if your bite, you can't really set your model with just front teeth. If you only have front teeth, your models are going to teeter-totter. So you need this wax rim in the back to set your bite. You do your wax try-in, those are in wax right there. Dismiss the patient, please process and finish for delivery. Okay, then you just deliver it, instruct the patient on how to care for it. For a partial or a full denture.
Take them out when you're asleep.
Take them out when you're asleep, at least 8 hours. You want at least 8 hours of rest, your gum tissues. What else?
Clean up the liquid soap, liquid hand soap, dentures.
Yep, liquid hand soap, no toothpaste, no abrasives. Biggest one is take them out after every meal and rinse them. Okay, take them out after every meal, especially, you know, they'll eat and they'll leave stuff underneath the denture, and they'll eat with it, and what's going to happen? It's going to cause a sore spot, and they'll be in. My denture hurts. Well, you know, they left a seed or something underneath there.
Well, what's when you took them out?
Yeah, that's the biggest one. Okay, let's take a 5-minute break real quick. So we'll see that the setup. Let me see if he's got the setup. Do that left.
We had, but there's something we need to know. From the last one.
Yeah.
Did we highlight?
He hasn't set them up.
No, not the last.
Yeah. They're secrets.
It's already in.
The lecture.
Are we safe?
Well, I
He asked me more for 14 today. Oh, he said, yeah. But I don't know.
Same. More room, my constant. You need more room. See, look, I need more room.
So you're hungry. I know. We have in 22 minutes, but 22 minutes. 2 minutes and 15 seconds. Who's counting? Or going somewhere? Do you go this too?
She's like, no.
The other part's like way too totally just went away from one thing. Oh, that's like so perfect.
4 days ago, I started getting
Shoots him in the neck.
The first time I did like the water system,
yesterday. I walked into a
just
I had to get stuff done. Things needed to get done, so I kept pushing myself, but I'm double jointed everything, so dislocating.
You like her?
Yeah, she's super sweet. She's nice, but it's just that it's just too. When you were there, was there anybody there? Like for
I went on her part is hard. Karen it's the and I was sick.
I mean, there was,
I was sick with
there
the
was
whole thing like
like a kindergartner,
and
she like
every
had a little
smell
stuffy her pig, and the pig was like
got
talking to me.
sick.
And then there was like a
my
2-year-old, and he was
I could
shooting
smell
me.
everything.
The 2-year-old.
My nose was so
were they both Chinese?
Yeah, right.
Yeah, see, like that's how when I was there, like there was a 1-year-old and a 5 and 6-year-olds, and then their little brother was there too.
Yeah.
So like, did I do good afterwards? And I was like, oh, and we were playing with the washing your hand thing.
Yeah.
They loved it, so.
I love it. I love it.
Well, then it's really cool. It's really cool. And then it's really smart. How many people came in when you were there? Two.
All the time.
She's there anyway.
Yeah.
Can't be there.
Sometimes I go to work
I know.
Just people like weird stuff, like so beautiful and like so
So it goes on the trial and then we'll put it away back in the closet or not.
Cases.
I'm lucky I'm not working.
Yeah.
Cause she has the room.
I
I come
hair.
here.
Yeah.
She's really nice. She's and her little dog's cute. Like see this dog like running down and what the heck.
That's right.
Yeah,
This
this
was
was
cute.
cute.
Like we're like, you have your yard party and all. And then she lets her use that.
It's like yeah, it's a little bitch. She's like so tiny.
It's
so cute.
It's like he was so funny. I can have like
So
oh she is it a girl or a boy?
girl.
Because when I sing, she keeps calling me. I go, oh, she's so cute. He's like, yeah, she is. It's a boy. But there's nothing on the stomach. I looked. Yeah, and then the dentist calls him a him. I was like, what the heck is this? And I picked it up, like held it. And
Just say it. Just
there it is. There it is coming down the hall. It's here. I hear it. Oh, here it is.
Because I thought it was a boy at first. That's what I learned. But then there was like she had a shower.
I know with little diamonds on.
Yeah.
Yeah.
It's like so
And there's no the man parts of the stomach, so it's definitely a girl unless we have some type of identity crisis on our dog. Like I don't know, so like so I'm just like
That's the next time you look here.
I'm a dentist too.
Then I have one at school and
I don't want any type of independence with children because I know that I won't want to cane. So I'm like, if Bentley is 5 and I don't have another one, like, I'm done. And I told him that. I was like, but he is like not potty trained, or like he's potty trained, he can go to sleigh, and then I asked him to talk.
Is he a good
I
looking
don't
guy?
want more kids, so you better take advantage
Like,
now.
I'm just wondering.
Well, I just,
No.
I'm so.
How old is he? Older than her? Like her
I
age?
have to start
I think they're the
over
same
again. Because I'm in that, maybe it's just because my son is
She
hard,
like teaches
very
too.
temperamental.
Yeah, she works at like that El Rio.
And it's because of your age too. Different ages, I know it's just different.
And my dad thinks that he has more patience.
Yeah, you just like change
Yeah,
with
my
age.
sister had two boys.
I don't know, I talked to Dr. Cervantes and he's gonna set me up with some of like his dentist friends. Because I was like, he made a good point, like I don't mind just narrow my connection with pediatrics. Like I need to expand it, I don't want to just be like pediatric or nothing, like I need to have all of it, not co-different fields.
And
Yeah.
Tomorrow I can grab some.
Yeah.
horrible.
So like yeah, I want to try to like a lot of different like specialized. Not so much like distance and stuff like this. Because I think that's good. It's a lot of I think that'd be amazing. Yeah. Big I just asked him about that. He said no.